Hi, we're here with Dr. Gary Joseph of BodyLogicMD of Cleveland. How are you today?
Well, thank you.
Great. Can you talk to us a little bit about the relationship with andropause and testosterone, please?
Sure. There's been so much information about andropause and testosterone more recently, and I'm glad to see this in the forefront because men finally are jumping on the bandwagon with testosterone. And the reason this is once we get to identify what is going on in our health, we know where we can find answers. With andropause, what actually happens is we're seeing a decline of testosterone in testosterone production, essentially, in men. And testosterone has very, very specific results when it drops low. Men start thinking that they're not sleeping as well typically. Typically, they cannot think as clearly. They may find that it's harder to lose weight than they were before. They may find that they fatigue. This is a huge complaint. Fatiguing either in the middle of the day when they were able to stay alert and vibrant throughout the day prior, or lack of motivation, lack of interest, signs of depression, essentially, many times lead men to search for answers. These are all signs of testosterone depletion. What we do at BodyLogicMD is we essentially test and make sure that those levels of androgens, your male hormones, your testosterone, is that this is adequate. And if it is not adequate, and by adequate we mean in the range of wellness, not just within the range of being on the chart, but back in the range of where you were physiologically well, physiologically young. This is not supra-therapeutic, just physiologically well. And it's incredible because after you see men get their testosterone levels back up, they start thinking, immediately, most of the reaction is typically this. I took off 12 pounds in the first, several weeks to months. I get up in the morning and I feel as though I have purpose, I have vision, I have drive. Certainly libido is improved because loss of sexual interest is also is caused by the loss of testosterone. And other things may happen as well. Hair may darken a little bit more. Vision sometimes will improve. And essentially, as we get past the depletion back to normal, men, the words, I feel like myself again, the self that they identified themselves as prior to andropause.